Here's what you should avoid if you have scoliosis. Patients with scoliosis are very often concerned about what things they should do, what things they shouldn't do regarding their activities or sports or even professions and in terms of what kind of career they should have and concerned about what kind of effects those things can have on their scoliosis. When a patient has scoliosis, the first thing we have to understand is that means they have an unnatural sideways of the curve of their spine. And it has a curve in their spine that has a rotation or a twist associated with it. This angle is what we call a Cobb angle, and it needs to be 10 degrees or greater, and it typically has a rotation that rotates into the concavity of that curvature. Scoliosis is classified by the size of Cobb angle, and there's normally 4 classifications I like to use. Mild curves or curves that are 25 degrees or less. Moderate scoliosis is considered between 25 and 40 to 45 degrees. Severe is anything greater than 45 degrees. And then I like to use a 4th classification, which I call very severe scoliosis. And these are when curves break 80 plus degrees or so in range. And when we understand scoliosis, we also have to understand there's many different types of scoliosis. And the most common types are something called idiopathic scoliosis. And idiopathic scoliosis is the majority of cases that are diagnosed of scoliosis. And we consider about 80 to 85% of all cases are diagnosed as idiopathic. And this is where there's no single cause. It's the most prevalent diagnosis, but it also means that we don't know what's causing the scoliosis to occur. The second type is something called neuromuscular scoliosis, and this is when scoliosis is actually caused by an underlying neuromuscular condition. These conditions can be like Marfan syndrome, Ehlers-Danlos syndrome, neurofibromatosis, cerebral palsy. Normally these neuromuscular conditions can affect the soft tissues of the body or connective tissues of the body, and they normally result in one of 2 types of things occurring. One is that the tissues become too laxed, and as a result of a laxed tissues within the body, the spine can curve as the patient is growing and developing, or they become too rigid or too tight or too spastic, and this tightness can lead to scoliosis developing while they're growing and developing. And then the last thing in this neuromuscular component is something actually wrong with the spinal cord, like a cyst or a tumor or a tether cord can actually lead to scoliosis. All these are put under neuromuscular conditions or neuromuscular scoliosis, and that's normally around 5 to 10% of all diagnoses out there. Congenital scoliosis is truly scoliosis that happens in utero, and it's normally it can be detected at birth. And this is where one of the vertebrae or one of the bones of the spine actually develop improperly into something we call a hemivertebra. The spine is a bunch of rectangles stacked upon top of each other, and one of those bones actually become a triangle in between all these rectangles. You'll get a curve right at the site of the deformed or malformed bone, and this is called congenital scoliosis. This is another 5 or 10% of all cases of scoliosis. These are the most common 3 diagnoses that occur in adolescence, but there are also some other causes in adult cases. In adult cases, there's another type called degenerative scoliosis, and this is where the spine has some type of trauma or injury or unresolved misalignment involved with it. It degenerates slowly over time, and this degeneration will cause the bones of the spine to wear improperly, and this leads to something that we call degenerative scoliosis or de novo scoliosis. This actually only occurs in the adult patient. And the last thing is something called traumatic scoliosis, and this is where the patient unfortunately sustains a relatively significant trauma to the spine. It can cause the spine to curve pretty quickly as a result of that trauma, and normally progresses from that moment on. And those are the most common causes. Obviously, when we have such a diverse causes of scoliosis, these can definitely be evolved or have a consideration in what things can impact that person or not. Now, one thing to understand is that does scoliosis always worsen? And unfortunately, the answer is more than likely yes, the curve will worsen. It normally, most commonly worsens, and what patients associate scoliosis progression to is they normally associate to growth or development, meaning as patients grow and they go through rapid growth and development, the curve has a chance of worsening. But let's say for whatever reason, when an adolescent would go through growth and development and there's no progression or minimal progression, do curves progress from that moment on? And unfortunately, the answer is yes, more than likely it will, because gravity is now pushing down slowly over time, and it's leading to something we call slow progression in the adult stage. In the adult stage, curve progression is directly related to the size of curve and the age of patient. So as curves become larger, Also, and as the patient becomes older, those two things in combination will increase its rate of progression, and we can see rapid progression occurring later on in life or late stage life because of this cumulative factor over their life. So we normally see rapid progression in 2 times, in adolescent stages and in late stage life, but it doesn't mean it's not progressing outside of those times. Those are just the most common times we see fast progression. It's because of this progressive nature, and because most patients are concerned about how scoliosis may progress in their life, many patients feel like they're scared to do anything, and they're scared to exercise, and they're scared to do activities. So a lot of patients are concerned whether, hey, I have scoliosis, can I exercise, can I do things? Well, understand that movement or exercise is very important, not only for spinal health, but really for overall body health. We know our bodies are built, designed to move and to be functional and to do things, and therefore we want to make sure we encourage those types of movements. Now, each case of scoliosis, like I mentioned, is very unique, and you can see there's many different causes and associated with them. So there's many different exercise restrictions or recommendations are very case specific, meaning every patient has to be treated like their unique set of circumstances that are associated with that person and their curve type and their causation, and also what they like to do. So therefore, certain activities should always be approached with caution when it comes to scoliosis, but they're not always avoided blanketly by every single patient, because some patients can have different causes or different things that are associated with their scoliosis or not. But generally, what should be associated, what should scoliosis patients be concerned about, or what should not associate with their sport or their activity? Well, obviously, things that create a tremendous amount of strain to the spine will be something that you would want to avoid. Any kind of compressive forces or downward forces, what I mean by strain, those types of impacts or compressive types of forces can put a risk into a patient with scoliosis to have more injury or more progression as a result of their scoliosis. Activities that have an increase of spinal injury purely can affect scoliosis patients more often, because if their spine already has a curve and already has asymmetry associated with it, these types of processes can affect the spine more likely than a patient that has a perfectly symmetrical spine and straight. Also, activities that can put the spine in an unnatural position, meaning moving your spine outside of its normal range of motion and putting it to its end ranges of range of motion, can possibly cause a scoliosis patient some problems. And then, of course, some activities that are very one-sided or very asymmetrical, especially if they're asymmetrical to the side of curvature, could also be something that we want to avoid scoliosis patients to do. When we look at specific sports or activities, the most obvious ones are the ones that have the highest impacts. Collision type of sports like football and hockey, maybe even soccer, some things that have high impact, high compressive forces to the body. They're more prone to spinal injury, or normally some kind of exercises or activities we try to avoid or try to discourage scoliosis patients from participating in. Activities that also affect hyperextension of the spine, like gymnastics, dance, ballet, even diving, this extension of the spine. And the reason why, because we believe a lot of patients with scoliosis have a very flat mid-back and an extended lumbar curvature. And what we do know is one sign of progression or likelihood of progression, especially in adolescence, is this flattening or hyperextension of the mid-back. So anything that promotes that flattening or hyperextension of the mid-back is normally something that we don't recommend. Sports that also overuse one side of the body. You would think things like tennis or golf or one-sided sports that you use one side, especially to the side that the spine is curved to, could possibly cause the curve to progress. Now, unfortunately, the literature regarding this type of theory is unclear. We really don't know which sports, which activities, which things can actually worsen or not worsen the scoliosis. And the reason why it's very hard to figure out is because no two curves progress exactly the same. And it's impossible to predict how much a curve will progress during growth or during adult stage or even late stage of life. So therefore, since there's no way to predict it, we have no way of really understanding which activities really affect the spine. These are just things that we're making assumptions on based upon logic and what we understand when it comes to spinal biomechanics. So the bottom line is, when a patient is under a good treatment process, Very rarely we give restrictions because we were going to hope that the treatment will affect the curve in a positive way that they can participate in any kind of sport. So therefore, your treatment provider should be the person that's looking at your treatment protocols, what you're doing, what activities you want to do, and which ones are the best for you. But finding a balance between what exercises and what activities you want to perform with versus the treatment that you want to do in order to maintain your scoliosis from progressing, this balance has to be weighed very carefully by your provider to give the very, very best outcome. And normally being proactive, meaning actively reducing your curve with a very specific scoliosis program that incorporates exercise, strength, passive rehabilitation therapy, self-corrective exercises, and sometimes bracing, and combining that in a way that's going to provide balance for you throughout your entire life is what your provider should be searching for and working for. And that's what we do here in Scoliosis Reduction Center, is being proactive to making sure the patient has the very best results, not only with the care, but also the activities they like to do. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.